Welcome back to the Coaching Show with your hosts, Master Certified Coaches Christopher McAuliffe and Jody Jen Larson.
Continuing now in our conversation with Margaret Moore, you may know her as Coach Meg. She is, famous for lots of things. The most recent is that she gave the opening talk at the Harvard Coaching Conference. She has spoken at the ICF conference. She is the principal of a company called Well Coaches. You can find them on the web at www.wellcoaches.com. And we're talking about her vision and the work that she's doing to address the healthcare crisis, address the crisis of both personal responsibility and wellness in literally the world through her vision of bringing coaches to wellness. Coach Meg, before the break, we were talking about your vision, and I'd love to talk a little bit more about how you've brought that to reality. I know that you're doing work with the American College of Sports Medicine, and also you've created something at Harvard Medical School.
Yes. If you're going to play in the healthcare or arena or mainstream medicine, one has to pay a lot of attention to the theories and science behind what we teach to coaches. And so we put a lot of effort. In fact, Lippincott Williams Wilkins, which is a medical publisher, is publishing our coaching manual or textbook in March, which will be really the first of its kind. And so we've done a lot over the last 6-7 years to bring together people, faculty, and concepts from a whole range of theoretical domains of psychology and kind of synthesize them into a whole. And we still have a lot more to do research studies, outcome studies, randomized studies to show that coaching works across a whole number of arenas. But we had to at least start with a scientific foundation. And so I early on sought institutional credibility by approaching the American College of Sports Medicine because they are the folks who set the guidelines for exercise and weight and obesity, along with the CDC at the federal level. It's a scientific and medical group, and they really bought into our vision around building this new professional competency and have helped us build certifications that follow the standards of the National Commission of Certifying Agencies, because they've done that many times before and they're known for that. So that was kind of one big step. And then I started looking around and talking to a lot of people about, where could we find an academic home for coaching that would give it more credibility? And that wasn't easy to find. And after an ICF conference, I created a team I thought coaches needed our own theories, not just resting on everybody else's. So I led a team that created a theory for the intuitive dance of coaching that we called relational flow. And one of my team members was Carol Kaufman at McLean and Harvard. And Carol and I came together to work on a coach training module that is built from relational flow. And we had a blast, and we clearly had very different backgrounds. She was a psychologist for 30 years who had become a coach, and, of course, I had very different background. And so I said to her after a day of training, Carol, what about starting an institute of coaching at Harvard and McLean? And that's what got us started. It took us a while to get launched, and one of the activities is the first conference that we had last year, which was groundbreaking because it was the first coaching conference at a medical school anywhere in the world. And as Jody can attest, we had a blast. We had physicians and psychologists and coaches all laughing and crying, and what happens often in coaching conferences, that wonderful energy, and yet there was still a measure of science and theory and the sort of things that the medical world needs. So I think we are really bringing those two worlds together, medicine and coaching, and I think there's a huge yearning on the part of medical practitioners for this whole competency.
So, Meg, what do you see as the distinction or to compare and contrast to what has been the standard of life coach training compared to what now you have created? And I'm, assuming it's quite distinct.
Well, we follow the ICF competencies, coaching competencies, very closely. So we cover them all. I think that I remember someone who had come from another life coach training school said to me not so long ago, what Well Coaches has done is put the theory behind the coaching concepts. So what we're teaching is very much in line with what coaches do. It's a little more structured, and we've connected the dots from, where's the theory and the evidence behind this particular concept. Why do we make clients work hard in sessions instead of giving them the answers? Where did that come from? Where did that idea come from? Why are we the ones that can get them to point B? There's a whole. So I think that's where our contribution, and I think our coaching manual will be really interesting to coaches in the life coaching arena because we have really kind of done that groundwork.
And what's the delivery method for the training? So, for example, is it something that we have to come to Harvard and sit in those hallowed halls in tiny chairs to learn?
No, our primary coach training mode is distance teleclasses, as many groups do. So weekly teleclasses over 3 months, fairly intense, and then the certification process follows that. So it is distance-based. We are beginning to run workshops, 2 a month around the country, which in an ideal world would be a step you take before coach training or even after. But we have to be very mindful of our price point because folks who work in healthcare don't make a lot of money. And so we've worked hard to keep the training, around or even below the $1,000 mark, because the higher priced coach training programs are just out of reach for many of these people, nurses, personal trainers, social workers, etc.
Well, let's talk about that. Are you looking to bring wellness coaching to existing coaches as a new modality or option? Or are you really looking to transform some of the people that are out there in the healthcare or healthcare helping professions? I assume that's what a personal trainer would be considered?
Yeah. Well, we've taken the stand that to really be a competent wellness coach, you need to bring expertise in one area of wellness, credentials, degrees, etc. So one of medicine or nursing, exercise, nutrition, or mental health. And so you can't become a certified wellness coach without one of those backgrounds. And so we tend to attract people who have been in their field for a long time. Most of our coaches are over 40, and they have a wellness orientation. They are tired of just focusing on illness, but they are also combining their expertise because people often really don't know what to eat. They don't know how to exercise safely. They might not be doing a good job managing their diabetes. They may have mental health problems, and so we feel you need to really have background in at least one of those areas and some sense of boundaries and risks and red flags, and so you understand that there are dangers.
Well, that lets me out, but Jody would be very good. I'm kidding about the boundaries, sort of. Okay, I know that our time just flies by, and I want to make sure that we get a few highlights in. You've got a gift for our listeners today.
Well, yes. Hopefully they'll view it as a gift. I worked with a psychologist for about a year on a metaframe for coaching psychology, some kind of organizing framework, and launched it at the Harvard conference. And we did a class afterwards, and that I'd love to share. And I'd love to hear from people whether they think it works. We tried to come up with a common denominator framework that would apply to across all of coaching, executive life, health, wellness, etc. And I don't know. I haven't heard from many people in many domains, but I would love feedback on it. We want to build on it, and I think it gives us. I think people will find it interesting.
That's wonderful. How can people get a hold of that?
Well, I can send you the links.
Okay,
and then you can forward them.
Great. We'll put it on our coaching show website. You can find that at wsradio.com. That's wsradio.com. Just look for the coaching show, and you'll find the link there. Also, I want to make sure you've got such incredible credentials. Not only 17 years with some of the biggest names in biotechnology and pharm, but also I don't mean FARM.
Yes, right, pharma. Yes.
But also, your Harvard Medical School, the American College of Sports Medicine. What I love is that you've also released a YouTube video. Will you tell us about that?
Well, yeah, so I'm glad you asked. So when I was working with BJ, the psychologist that came up with the metaframe, my friend at Harvard, Carol, said to me, Margaret, this is way too complicated even for psychologists. You've got to, find a way to simplify it. So I thought, well, why not create a video? And I worked with an animator, and it was really a blue sky project. We really didn't know where we were going, but we came up with this YouTube animated video, which I really like. I mean, I've got a bias because we worked hard on it, and a lot of our coaches are using it because coaches struggle to describe what we do, and it sounds sort of banal to say, I help people be their best, I help people go from point A to B, I help people, self-actualize, and it somehow it lacks appeal, and so I was hoping that the video would make people smile.
Great,
and say, I get what I get what coaches do.
What's it called?
How Coaching Works.
Okay, so we can go to YouTube.
You can go to YouTube and put in either How Coaching Works or Well Coaches.
Great. We've got about 30 seconds left. I'm going to give you a chance for a parting shot. If you had something to say to a few thousand coaches, what would you like us to know?
That's a good question. I guess my stand as Coach Mag is really to encourage and support people to take responsibility for their personal health and well-being and get it done and get the help you need to get there. So I think that would be my parting comment. We need you. We need everyone on this journey. We really need a societal shift towards really taking care of our health for the betterment of all.
What a beautiful, beautiful, powerful note. Thank you so much for being with us, Coach Meg. You can find out more by going on the web at www.wellcoaches.com. If you see Benjamin Zander around there in Boston, tell him hello for us.
Oh, we will, yes.
Excellent.
Yes.
Thank you so much for being with us. Jody, we'll be back with more of the Coaching Show right after these words. Stay with us.